The ratio of partial pressure of oxygen in arterial blood to the fraction of inspired oxygen concentration is an indicator of pulmonary shunt fraction. Basically, this ratio helps us to determine how much of the lungs is not working. Or we can say we determine a part of the lungs which is participating in gas exchange, and by this we can suppose how badly lungs are injured. The ratio of partial pressure of oxygen in arterial blood to FiO₂ we use first of all to assess the severity of acute respiratory failure. The major criteria is partial pressure of oxygen in the arterial blood less than 60, combined with ratio of partial pressure of oxygen in arterial blood to fraction of inspired oxygen less than 300. And the second condition is acute respiratory distress syndrome, where ratio should be also less than 300 under positive and expiratory pressure. The normal value of arterial partial pressure of oxygen to fraction of inspired oxygen is 300 to 500. Everything below 300 is pathological. So to explain the ratio, here we have alveoli, and here we have capillary with red blood cells. And red blood cells have hemoglobin that should bind oxygen. Typically, the room air contains 21% of oxygen. So in normal condition, the fraction of inspiratory oxygen concentration is 21%. When we inhale, air comes into the alveoli, and from alveoli, air diffuses through the alveolar membrane into the capillary. Inside the capillary, hemoglobin binds oxygen, and then hemoglobin carries oxygen to the tissues. In this case, if we determine partial pressure of oxygen in the arterial blood, which is basically oxygen concentration in the blood, it will be approximately 90. But let's suppose that severe obstruction occurred and now 2 out of 3 alveoli are not participating in gas exchange. And let's suppose that this person inhales the same room air that has 21% of oxygen. In this case, oxygen incomes to the alveolus and then oxygen diffuses into the capillary blood, where hemoglobin binds oxygen. And now, if we measure partial pressure of oxygen, it will be just 1/3 of previous oxygen pressure. So in this case, it will be 30, which is definitely a pathology. And such severe hypoxemia will manifest with severe clinical symptoms. And typically, a person with severe hypoxemia requires supplemental oxygen, just to increase oxygen concentration in the blood, and by this we can decrease the severity of clinical symptoms. So now the same person inhales supplemental oxygen with 100% oxygen concentration. So in this case, this massive amount of oxygen incomes to the alveolus. And from alveolus, oxygen diffuses into the capillary where we have red blood cells. Hemoglobin inside red blood cells binds oxygen and then carries oxygen to the tissues. And prolonged inhalation of supplemental oxygen can cause significant increase in partial pressure of oxygen in the arterial blood. Let's suppose that in this case, we determine partial pressure of oxygen 150. So we know that 2/3 of lungs are not working, so it's a pathology. But partial pressure of oxygen in the blood is high. In this case, in normal condition it's 90, and with supplemental oxygen it's 150. So it's even higher than in normal condition. And previously, with the same air, it was 90 to 30. So if we do not know how much of the lungs are not working, how to compare the values of partial pressure of oxygen with room air and with supplemental oxygen? And for this purpose, we have ratio. So if we divide partial pressure of oxygen in the arterial blood, which is 90, to fraction of inspired oxygen, which is 21%, now we get 428, which is within 300 and 500, so it's normal. In case of pathology, if we divide partial pressure of oxygen in the arterial blood, which is 30, to fraction of inspired oxygen, which is 21%, we get 142, which is below 300, so it's a pathology. But with the same room air, we already know that 2/3 of lungs are not working, simply based on oxygen pressure in the arterial blood. Where this ratio is really useful is in cases where inspired air is different. So in case of supplemental oxygen, partial pressure of oxygen is 150, and fraction of inspired oxygen is 100. If we divide them, we get 150, which is below 300, so it's a pathology. So in this case, we know that only because of supplemental oxygen, this person has normal or even elevated partial pressure of oxygen in the arterial blood. So without supplemental oxygen, he will immediately have severe hypoxemia. And the reason is that 2 out of 3 alveoli in the lungs are not working. But the problem is that when we see patient, we do not know how many alveoli are not working. But we can determine partial pressure of oxygen, and also we can determine the fraction of inspired oxygen. And with the help of these two values, we can say how badly lungs are injured. So to summarize, in normal condition, we have 3 working alveoli and 21% of oxygen in the air. Let's say it's 6 oxygen molecules. When they diffuse into the blood, they create a partial pressure of oxygen 90, and this gives us the ratio of 128. In case of pathology with supplemental oxygen, we have 1 working alveoli and 100% of oxygen in the air. This creates a partial pressure of oxygen 150, which is even higher than normal. If we divide oxygen concentration in the blood to oxygen concentration in inspired air, we get 150, which is definitely below normal values. And if we compare the ratio in normal condition to ratio in pathology, we see that in pathology the ratio is 3 times lower than normal. Means that only 1/3 of lungs are still working. So as we see, if inspired air is different, the only value that can help us to assess the severity of respiratory failure is the ratio of partial pressure of oxygen in arterial blood to the fraction of inspired oxygen concentration. So in normal life, we do not see alveoli are injured or not. What we see are numbers. We know that normal partial pressure of oxygen in the arterial blood is higher than 80. So we see that in first case, with room air that has 21% of oxygen, person has partial pressure of oxygen 90, which is normal. In second case, with the same room air, person has partial pressure of oxygen 30, which is approximately 3 times lower than normal. Means that most probably 2/3 of lungs are not working. But in third case, it's not that obvious. Person has a lot of oxygen in the blood. His arterial partial oxygen pressure is 150. But person is on supplemental oxygen with 100% oxygen concentration. And we cannot compare partial pressure of oxygen in the blood in person on room air and in person on supplemental oxygen, simply because income of oxygen is different. So in this case, we use the ratio of partial pressure of oxygen in arterial blood to fraction of inspired oxygen, and the normal values is 300 to 500. In first case, the ratio will be normal. In second case, it's 3 times lower than normal. And we see that in third case, it's also 3 times lower than normal. So, partial pressure of oxygen in the blood alone cannot determine severity of respiratory failure if inhaled air is different, but the ratio can. And because of this, we use this ratio to assess respiratory failure in critically ill patients.